6:40, and welcome everybody to the meeting. We will open up with prayer from our Religious Affairs Co-Chair, Pastor Kennedy Jones.
Let us bow and pray. Most gracious and wonderful God, we thank you for tonight's event. We thank you for the speaker. We thank you for allowing us to convene and consider the matters of the people. And we pray, oh God, that we would continue with conviction and commitment to this great work, which needs to be done. In Jesus' name we pray. Amen.
Amen. Thank you, sir. So just wanted to give a brief president's report, and then we'll hear from any committees that have an update to provide. Wanted to let folks know that I did meet with the police chief. It was our first face-to-face meeting. We've seen each other at community events, and so this is our first time sitting down and having lunch together. And so we have we started the relationship when he came and he addressed the NAACP at our February meeting, but this is the first time that he and I sat down. So looking forward to a good relationship with Chief Al Jones, and him supporting the work that we do, and the NAACP supporting what he is planning to do and doing so far in his new role. Also wanted to talk about, we have a youth council, Arlington NAACP Youth Council, and it has been defunct for about a year and a half. And so we are trying to revitalize the youth council. So if any of you have children or grandchildren or nieces or nephews, or neighbors, friends that would be interested in learning more about social justice and civil rights and joining us in the work that we do in Arlington, please let us know. We will drop in the chat contact information for our current youth advisors, so that you can contact them. At this time, we are offering free memberships to any youth ages, I think, correct me if I'm wrong, Ms. Mannings, grades, is it 8th through 12th or 9th through 12th?
The ages are 0 to 25, but.
Okay, 0 to 25 for membership for youth. So right now we are, we will take care of or cover their costs, or at least the national NAACP will. So send those students our way. Also wanted to let you know and encourage folks to continue to look at our Facebook and Twitter and Instagram pages. The city of Arlington is hiring staff. They're looking for a chief equity officer. They are looking for a new grants manager, and they will be staffing this equity office and MWBE office. So they are beefing up the staff there. So make sure you look at City of Arlington's human resources pages. They contact us frequently and let us know that these positions are open in their attempt to look for diverse candidates. So we need to be applying for those positions and sending people, qualified people, to apply for those positions that we know. So they can't ever say they've reached out to us, they contacted us, and nobody that looks like us applied. So they do have a variety of positions that they are staffing that should be of interest to a lot of people, especially if you're interested in diversity and inclusion work. Many of us, a lot of us from the executive board attended the state NAACP quarterly meeting this past weekend. And so we were there with other branches and other leadership to talk about many issues, including, what the governor and the state legislature is done to gut voting rights in Texas. And of course, redistricting is going to be a big issue once those census numbers come in. And so just voter suppression efforts, you see it every day on the news. So it's happening. It's happening in this state, and we've got to continue to fight against those efforts. You can expect that once Governor Abbott signs those oppressive bills that suppress the rights of those to vote, the NAACP will be filing a lawsuit against the state of Texas. So that's forthcoming. There's no secret there. As soon as he signs it, we'll be filing lawsuits at the state level and possibly the national level. Speaking of redistricting, and let me say this first. We, of course, we just had city council municipal runoff elections. And so in Arlington, there was a city council seat up it was contested, and a mayoral seat. And so Jim Ross was the winner in the, and will be our new mayor. He defeated Michael Glaspie, who had previously been on council and school board. And also in District 3, which is currently Marvin Sutton's seat. Marvin decided to give up that seat to run for mayor and was not victorious. So a young lady by the name of Nikki Hunter won in that runoff. So we will have a new mayor and a new council representative for District 3. One of the things that's so discouraging as you look at elections across Arlington, across the county, across the state, is the low voter turnout. And while there are 880,000 registered voters in Tarrant County, in Arlington, only about 20,000 of those voted in this runoff. So, it's infuriating on some levels, because we talk about voter suppression and those efforts to keep us from voting. But there's so many people who are registered to vote that could and should go vote and don't vote. So 888,000 registered voters in the county. And in Arlington, only 20,000 went out to vote. So I said all that to say you get what you get. And it was none the more evident today during the Arlington City Council afternoon session. It was the most infuriating exchange I have seen. And there were a number of issues that they were considering on their agenda. And it just makes you shake your head. But one issue in particular.
Was it worth the price of admission?
It was worth the price of admission, sir. It was worth the price of admission. I'm surprised I still have a laptop, because I was just turning over everything in my office. It might look disheveled around here, because at issue was redistricting. Now, there's redistricting at the congressional level, but there's also, and this was our topic not last month, but the month before last, there's also redistricting at the local level in this city, where population growth, we'll see from the census numbers, could dictate that the lines are drawn differently in Arlington. And so by virtue of a growing population of minorities that have moved into the city, that have moved into any suburban area, that have minority population has grown anywhere you look. There could be new lines drawn, and we could have new city council districts and that type of thing. And so at today's meeting, Councilman Sutton suggested that, or he wanted to, he not suggested, he was very clear. He wanted to make sure that if and when the city stands up a citizens redistricting committee, that a representative from LULAC and a representative from the NAACP were sure to have a seat on the redistricting committee. The amount of pushback from council members was eye-opening, and I will implore you to go and watch today's afternoon session. You know, at first I was going, well, this is just par of course that, you know, these white folks don't want representation on the redistricting committee from NAACP and LULAC. But on the other hand, it wasn't just the white folks. So it was when Mr. Sutton put out, you know, the expectation that, yeah, we should have LULAC and NAACP. They should have a seat at the redistricting table, because in fact, they know how to draw maps, interpret maps. There's no more pre-clearance. And he was very clear, if something goes wrong, the NAACP and LULAC will be the ones that file lawsuits. And it will happen here in Arlington. So you may as well have them at the table. The mayor said, you know, I don't know. They can, you know, we've had them do this before, and they can give a presentation and the committee can hear from them, but I'm not sure they have to be at the table. Raul Gonzalez, Councilman Raul Gonzalez, and yes, I am absolutely calling names, said, well, what about the Asian community? And what about the Democratic club and the Republican club? How many groups will have to have a seat at the table? Councilwoman Odom Wesley suggested that there be ex officio members, and that NAACP and LULAC have ex officio seats on the committee, which means a non-voting position on the committee. It was truly astonishing. The city attorney, you know, I can by the time I excerpt everything she said and everybody else, and if I excerpt it and publish it, it will be very apparent to each and every one of you listening that the city of Arlington has no intention of being inclusive in this redistricting process. The 9 council members appoint who they want to appoint. So Councilman Sutton's recommendation to have a seat for LULAC and NAACP is very appropriate, because, you know, our council is they will go get their friends who don't know a lot about redistricting, and my NAACP appointee that's in charge of redistricting for this branch knows redistricting. So that's why we need to have a seat at the table. So we're gonna drop the link in the chat and encourage you, and in fact, post it on our channels. Encourage you to go watch that portion of the meeting in which just about all of the council members were not enthusiastic about having NAACP and LULAC, who are redistricting experts, on the city's redistricting committee. It was truly phenomenal. And, one thing it was an expectation. Let me just say I guess now is a wish and a hope that when Councilman Sutton made the recommendation that Dr. Barbara Odom Wesley and Councilwoman Woolridge would have stood behind him 100% and said, absolutely, those two storied, historic civil rights organizations should be at the redistricting table in Arlington. I do not understand their reticence, and I do not understand, the rest of the count. What are you afraid of? Or they're just trying to keep the lines like they are so they can continue winning these elections in which they have the power. So I said that about redistricting and voting. If you don't vote, you get what you get. You get these types of elected leaders on the council, white, Black, Hispanic, whatever, who are afraid or beholden to, I don't know, the mayor or whoever they think is the most powerful amongst them, with total disregard for their own integrity and their power. Because in Arlington, you're really term limited. I mean, so you're not, for now, you're not going to serve on that council seat, any more than 6 years. So, why you're afraid to stand up for what's right is, it is beyond me. But, I am preaching to the choir. All of us are registered to vote and we vote. But we've got to get out in this community and tell people this is what you get. Let's see, what time is it? Almost 7. So I want to talk, the last thing I want to talk about is housing. The Arlington, the previous presidential administration and the Biden administration have funneled a total of $21 million to Arlington. They've given $21 million, allocated $21 million to Arlington for rental assistance. Evictions continue. There is a problem here. Of the 21 million, the city of Arlington has distributed just under 700,000. Hear me when I tell you, $21 million from the federal government strictly for rental assistance. And they've only helped people to the tune of $700,000. We're talking to the city about it. We've been talking to the city manager, working with the deputy city manager and the Arlington Housing Authority director. to improve the distribution of the allocation. Because today, people got evicted from their homes and apartments. And Arlington has $21 million in funds for rental assistance. So, to the people that are hearing this, I'm going to tell you what they're saying. You're not applying for it. They mailed you a letter, and you've had 45 days to fill out paperwork, and you didn't, and you get evicted because the landlords can't continue to let people live in their properties for free. So that's what they will tell you. But what my team has determined is that their marketing efforts have been lackluster, if not 100% weak. So if you send me a letter one time, I just check my mailbox after 3 days. I don't do mail. And then I walk it right to the recycle bin. And if it looks like it's a whatever, it gets shredded or recycled. So I've asked them, how many times do you touch these people that you know are at risk for eviction? Well, we send them a letter in the mail. So my team is working with them, and we've given them all sorts of recommendations. We've talked to Justice of the Peace, who said it would be helpful if Arlington Housing Authority would have staff in the courts on the days that evictions are on the docket. And so they said, okay, we really can't do that, but they've sent a staff over there once or twice, and they've been able to help the people who are in court to be evicted. So they've been able to avert that. So it's helpful because you don't know if people aren't technologically savvy, have literacy issues, work. You don't know what, work 3 jobs. You don't know what their situations are and why they haven't completed the form. And so this one apartment complex, Los Lamos, has evicted 30 people in the past few days. That's a problem. And when I talked to the housing authority director today, she talked to her staff, who told her, yeah, that's a problem location. So if they've always been a problem location. If you know that, why do you have to get a call from the NAACP to handle it? Just, a lot of things going on. I have not even talked to you all about education or any of the other issues, but those are some of the top issues that we wanted to make you aware of.
Alyssa,
Yes, sir.
so what happens to those funds that they have that go unused? I mean, you said 21 million and maybe 700,000 has been distributed so far. I mean, what happens with that money if it's not allocated to those that are being evicted?
I'm not sure. I think their goal is to use it. I'm sure it's earmarked just for what it's for.
Okay.
It's rental assistance.
Gotcha.
They didn't know what to do. They had to beef up their staff. COVID, to be fair, COVID took everybody for a loop.
Right.
And so they didn't have, a huge housing authority staff. So they had to hire people, train them. So we understand it's a process. But, there are a number of things that they're not doing. And as a result, people are being evicted every day.
Right.
And this money is there. So what the housing director said today is, they were evicted today, it still has some processes to go through.
Right.
So, might be able to be reversed. Now, another thing, not just here advocating for tenants, but also landlords. There's money for landlords.
Right.
So if you are out there, you own a rental property and your tenants have not paid, you need to go to the Arlington Housing Authority website, fill out the short application and get your money. And you and the tenant can work together where you get your money that's owed, the back money owed to you, and
Right.
your tenant gets money. They'll pay their rent for a year, up to a year.
Right.
So, but a lot of landlords just at this point want people out of their property so they can move on. And this is just a personal thought. It's my estimation that with the way housing prices are now and rent prices have increased, they probably want those people out so they can double their rent and make more money. I don't know. It's just a thought.
Right.
So
are they, as a housing authority, are they working with other organizations outside the NAACP from a knowledge standpoint for those things? I mean, you said they're understaffed, but do they usually connect with folks low income or folks that may be in these situations even outside of COVID? I mean, is that the normal
for
practice?
Section 8 and things like that, I think she mentioned, and I'll let Billy, Mr. Wilson jump in because he was on two of the calls today with the housing director. But they have, partners throughout the county. And for the people, for example, that, landlords absolutely are not going to take back because, in fact, it is their property and they have the right to say, nope, we don't even want them back.
Right.
They have, the housing authority works with other agencies to help rehome these people and find them someplace else to live.
I got you. Okay.
Mr. Wilson.
Yeah, to me, the big problem is a coordinating issue, because not only we talking about Arlington, but there's also Tarrant County. I was going to put a link in about the housing channel. They have a lot of resources and these people have a lot of money. And the purpose of the money that they're getting is to make these connections. Same thing with not Salvation Army, United Way. I was on a call with them. They got something like a $20,000-$25,000 grant. I think that's low. It actually might be more than that. And the whole purpose of the grant was to make these connections happen.
Right.
And so there are a lot of people out there, resources out there for people, but the coordination is terrible.
Yeah.
Right.
Okay. It is 7:02. And are there any other questions for me about anything I have shared? We'll drop some links in the chat. Go look at the newsletter. We put some good information in there. There's a bid process that will be starting soon for the National Museum of Honor that's going to be built in Arlington. City has a 30% MWBE goal. I've been talking to the folks there, and they're making every effort to reach out to minority contractors. Right now it's phase 0 and phase 1. So you need to look at that, share it with everybody in your circles so that they know it's out there. This work is out there for contractors, and they can bid on it. I think that's it. Still waiting on some numbers from AISD about graduation rates. We'd heard that the graduation rate at Sam Houston High School was like 38%. I will try to get confirmation about that and put that out there. If that is the case, that is indeed atrocious. So, yeah. So, you can't have 38% of your seniors graduating. But let me confirm that number and get back with you. Lots of issues, though. If you know people that want to volunteer with us and help this busy board of NAACP members, let us know. I'm going to turn this over to our health committee chairperson, Lisa Staples Weary, so we can move on to our program.
Thank you, Madam President. Good evening, everyone. Tonight we are going to be talking about the Affordable Care Act. There's a guest speaker, actually two guest speakers that we'll have on tonight. We'll have on Daryl Mayfield, who actually has spoken to us before in the past about ObamaCare when it was called ObamaCare, and also a Corey Corton. Corey is with the National Association of Health Service Executives. So first of all, I want to thank everybody for getting on. It is my personal belief that no one should be uninsured in America, especially my president, President Barack Obama, made that possible. And I just really feel like that's a personal statement. So it's not backed by the NAACP or the Arlington NAACP. It's my statement and my statement alone. I feel like no one should not be covered by healthcare. Last month, we talked about mental health care, and this Affordable Care actually covers mental health as well as your medical health. So first, I'm gonna ask Ms. Tahani Manning to plug in the video, and we'll watch a 2-minute video. And then we'll go straight to our first speaker, Mr. Daryl Mayfield. Thank you.
Signed into law in March 2010, the Affordable Care Act benefits all Americans, increasing access to quality, affordable health insurance and providing rights and protections that make health coverage more fair and easy to understand. The increased access to insurance options helps narrow geographic, economic, and racial disparities in healthcare coverage. Here are 5 things to know about the Affordable Care Act, also known as the ACA. First, the ACA produced widespread gains in health coverage. Over 20 million people gained insurance, including individuals who can stay on their parents' plan until they're 26. Second, the Affordable Care Act protects Americans with pre-existing conditions like cancer, asthma, or diabetes. Insurance companies can't deny coverage based on a person's medical history or health status. The law also prevents insurers from setting annual or lifetime limits on spending. Third, the ACA focuses on preventive care. It ensures that most insurance plans fully cover the cost for certain recommended preventive services. Colonoscopies, mammograms, well child visits, and flu shots, for example, are provided at no cost to the patient thanks to the ACA. Fourth, the ACA improves health care for women and children. The law prevents insurers from charging women higher premiums than men and requires insurers to cover maternity care, breastfeeding support, birth control, and other services critical to the health of women and children. And Medicaid expanded to include millions of low-income individuals and families who did not previously qualify for coverage. Fifth, the Affordable Care Act is better than ever. Coverage options are increasing, and costs are decreasing. President Biden's economic stimulus package, the American Rescue Plan, ensures that many people who enroll in health coverage through healthcare.gov will qualify to save money on plans that meet their needs. Many premiums will decrease on average by $50 per person per month and $85 per policy per month. 4 in 5 consumers will be able to find a plan for $10 or less. For more information or to sign up for affordable coverage, visit healthcare.gov. Produced by the U.S. Department of Health and Human Services.
Okay, thank you so much, Ms. Manning. That was a great overview about what we're going to talk about tonight. I wanted to do that overview so we can just actually dive into our 2 presenters, and both of them are on. I did put healthcare.gov in the chat so that if you're on the call or know anyone that actually needs to sign up for insurance, they can go straight to that website. Our first speaker, if you have any questions also, just add those in the chat. That will be great. We do have someone that will be manning the chat to answer those questions. So our first speaker is Mr. Mayfield. I saw you on, Mr. Mayfield, and you can come on now. I'll toss it over to you. Thank you for being here.
Hi, it's my pleasure to be here. And I wanted to reiterate one thing that you said a little earlier, because I think it's really a key feature of the ACA is the mental health component. Mental health is covered under ACA plans and a problem in all communities is mental health. So if people don't think they need to have coverage, but they know that they're having anxiety or whatever their problems are, it's a really good reason to go and get signed up. On March 11th of 2021, President Biden signed the American Rescue Plan Act. Most people know it for the $1,400 stimulus check, but it also did a lot more things than just to provide the stimulus. And one of the things that it did is it significantly improved the ACA. President Biden actually ran on improving the ACA. When other people were saying, hey, let's scrap it, Medicare for all, whatever. He said, first thing we need to do is improve the ACA. And so let's talk a little bit about the improvements. Number one, the plans offer lower premiums. For most people who currently have plans, they get lower premiums. And people who want to have coverage will get lower premiums. And one of the important things about being able to say people who want to have coverage is normally this is not open enrollment. But what President Biden did was he has extended open enrollment until the 15th of August. So there's a significant amount of time for people to still get covered. So the way that the ACA works is that the amount of the subsidy that is applied to your health insurance premium is calculated by household income and the number of people in the household. When I say household income, it is the anticipated household income for that year. So a lot of people go, well, I don't know what I'm going to make, or right now I'm on unemployment, or so it's better to guess than to not have health insurance. And that's just kind of a comment that I'll make. So what happens is if I do a quote for a person, my software is automatically going to look at that family and the income that we put in, and it is going to give those people plans based upon the income and the family size. The benchmark for all plans is the second least costly silver plan in the market. that benchmark is used to calculate what the rates are that are used to calculate people's subsidy. The subsidies are actually tax credits. And what happens is the government is giving you a tax credit. They're saying, we're giving you a tax credit to buy health insurance. And you can either spend that tax credit on your health insurance premium, or you can just pay for the health insurance and take that tax credit on the end of the year as just a credit against your, whatever your income taxes would be. I haven't met a person yet who decided to take the tax credit on the end of the year. Everybody needs to save money on the health insurance premiums. And, you know, the premiums are expensive if you don't have the subsidy. And the premiums are expensive because the coverage is comprehensive. I mean, everything is covered. So, excuse me. So, you know, that's one of the key things that the people have missed out on, I think, over the years, is just the fact that you can get a much more comprehensive plan than what people are used to having, and have part of it paid for by the government. That's a good deal to me. So basically what happens is, under the new rescue plan, the subsidies are recalculated, and the tax credits, and therefore the subsidies are recalculated. Okay, and that recalculation is what reduces the premium, because when your plan is recalculated, then there's a decrease. There's a decrease in your premium, because the premium for the plan stays the same, but the subsidy that is applied to the plan is increased. Okay. The other thing that happens under the American Rescue Plan is, previously people who made more than 400% of the federal poverty level were not eligible to receive a subsidy. So you had a lot of situations where you have a working family and two people who make a decent income, and let's say they're self-employed, and they weren't really able to benefit from the subsidies. That was one of the holes in the Affordable Care Act. Now, people in that situation can receive a subsidy, okay? And that subsidy is basically says that they can pay up to 8.5% of their household income in health insurance and receive that subsidy. So that is one of the real benefits of the plans, because it has been now made available to many more people. I would encourage anyone who has looked at it before and said, oh, well, no, it doesn't work for me because I don't have enough, or I have too much income to qualify for a subsidy. It's probably not true anymore. So it makes good sense for people to go back in, even if they just go to healthcare.gov and do a calculation to see if they can benefit. The other thing that is being done under the act is that people since so many people received unemployment benefits in 2020 and 2021, taxpayers who receive unemployment compensation during any week beginning in 2021 can receive tax credits to help pay for their 2021 marketplace coverage. So just because you're on unemployment doesn't mean you can't get a tax credit. As a matter of fact, you get a special tax credit. So that is one of the things that we, want to do is encourage people to just go and find out what kind of deal they can get. In the little video you played, it explained that in most cases, the reduction in premiums is about $50 per person. Okay, so if you got a family of 4, you're looking at people whose premiums are going down by $200. And I'm, doing those for people every day, and that is a big difference. The other thing that happens is that people can decide. You have basically 2 choices. If you have a premium, if you have a low premium right now, you might look at that low premium and go, okay, I'm not going to really get a big benefit from this subsidy because my premium is already low. But what you can do is you can take that excess subsidy and you can apply it to your federal income taxes that you would owe for 2021. Okay, so the tax credit is yours. How you choose to use it is just really dependent upon what your circumstances are. So most people, like I said, it just depends on what people are paying for their premiums. I mean, your typical person is, I have a lot of clients, for example, who pay $20, $25 a month for their health insurance premium, and they might receive another $10 reduction, and they just say, well, I'll just apply that $10, or I'll make sure that there's not any possibility that I was overpaid in my subsidy by just kind of banking that money to go against the federal income taxes. Okay. People should apply now. So this is the way it works. Up until August the 15th, people can apply. Their coverage becomes effective the first day of the following month. So on June 30th, a person can apply and have coverage July 1st. Okay? That is going to go up until August the 15th. August the 15th is going to be the cutoff. And the reason that August 15th is going to be the cutoff is because healthcare.gov has to get ready for the 2022 year. And the 2022 year starts in October. So if you don't sign up by August the 15th, you can't really sign up until you can't really sign up for the rest of 2021 unless you have, some kind of special enrollment situation, like, you lose your job or something like that. Otherwise, you just have to wait until 2022 to get health insurance. So we're looking at a situation where we have decreased premiums. We have a friendly administration who has made it easy to sign up. So there's no better time to do it than now. And then obviously the other thing that happens is when you sign up for 2021 coverage, the marketplace automatically assumes that you're going to want coverage for 2022, and it is going to offer you the closest plan to what you have in 2021. So at least people have kind of an automatic opportunity to re-enroll without having to take much action. So as I said earlier, the key thing is that the open enrollment was expanded all the way until August the 15th. The tax credits have been significantly increased, reducing premiums, and people who previously couldn't qualify can now qualify. Those are kind of the key things that I'd like for people to know about what the Congress did with the changes to the Affordable Care Act, I'm enrolling people every day, and people are benefiting. So if you don't have coverage, then you definitely should have it. Anyway.
Okay, Mr. Mayfield, I'm gonna interject here. Thank you so much. I know that you've enrolled personally over 1,000 people being a licensed insurance agent, and I know those people are very happy for that. You've told me stories how you've helped different people. And now there's a question in the chat. Does this involve or include vision and dental?
There are plans that include dental and vision, yes. So there are some plans that are fully comprehensive with dental and vision. The and if you can actually buy dental and vision from healthcare.gov, but the subsidies don't apply. So the subsidies would only apply to a plan that actually officially integrates the dental and vision into the plan. So if you have a plan that is comprehensive as dental and vision, then your subsidy is going to apply to it. But if you buy a plan and then you go and you pick a dental and vision plan on the marketplace, you're not really benefiting from having bought it on the marketplace because the subsidy doesn't cover it.
Okay. I have another question. Will you spoke about guessing your household income. Will you be penalized if you don't have that information correctly the following year?
No, the answer is yes. So when I say guess, I mean, we don't just like throw something up against the wall. When you guess, you really want to make an educated guess, but it doesn't have to be exact. And that's the kind of the key point that I wanted to make, is that if you can if you have an idea of what you're going to possibly bring in, then I would say, let's use that estimate. And then a lot of times too, things change where a person might lose their job. And in that case, then actually at the end of the year, they would get money back for having overpaid for their health insurance premium. So,
okay.
So sometimes it just doesn't hurt to just go ahead and say, let's get some health insurance coverage.
Okay. There's another question in the chat. I think you've already answered this though. If you apply by August the 15th, then do you need to reapply in January, or does it? Okay.
Yes, you need to, well, what will happen is this. The company that you enroll with is automatically going to send you out they want to automatically re-enroll you, okay? So they're going to automatically send you out a re-enrollment. I encourage my clients to give me a call. And let's just make sure that we're getting the best possible deal. Okay, so, but yes, you will have to, in October, you'll have to re-enroll. You'll either have to accept what they send you, or you'll have to re-enroll for 2022. Plans are year to year.
Okay. Are there any more questions for Mr. Mayfield? Does anyone else have any questions that did not put them in the chat?
I got a question. I've been fortunate enough to have an employer who offers, comprehensive insurance coverage. So my medical, dental, vision, all that from my family. Now, do those subsidies apply in those cases, or is it only through the ACA?
No, the subsidy doesn't apply in that case, except it is possible, depending on the size of the company, there are subsidies that are available to companies with less than 50 employees to help them pay for coverages like what you have. So a company in a situation like that that's actually offering a group coverage, depending on the size of the company, they would want to look into whether they would qualify for what they call a small business opportunity market, the shop marketplace, which provides some additional subsidies to that small business to encourage them to offer benefits to their employees.
Okay, great. Couple things I just want to reiterate that the pre-existing illnesses and conditions are automatically covered. You can't be denied if you have any of those medical pre-existing illnesses or diseases, and that the ACA does cover preventative care, your colonoscopies, your mammograms, and things like that. Correct?
That is absolutely correct. There are no pre-existing conditions.
Okay.
And I'm just going to make a kind of a political statement here, because I want everybody to watch out for it. You know, there's people who say, "Oh, we don't have any plans to do anything to pre-existing conditions. We're not going to do anything to pre-existing conditions." What they really mean is that they're going to offer you pre-existing conditions, but they're just going to charge you more. They're going to make it so expensive that you can't afford to have coverage. So, you know, we have to, help people to understand that when folks say that, what they really mean is they really don't want you to have subsidized coverage. They want to take away that subsidy. They want to charge you for your insurance. And if you're sick, they want to charge you more for it.
Okay. And the insurance also covers for a new birth, divorce, marriage, loss of insurance, those type things as well, correct?
Right. So if you have a change in your family situation, babies are covered when they take their first breath.
Okay.
If you adopt a child, okay. If you have a loss of a job that causes the health insurance to be lost, those are special enrollment conditions that would allow people to enroll anytime during the year.
Okay.
One of the other ones too is that a person can get a special enrollment period if they lose Medicaid. And they can also get a special enrollment period. Now watch, I have a smile on my face when I'm saying this. They can also get a special enrollment period if they apply for Medicaid and or denied Medicaid in Texas. You know, the only people that can get Medicaid in Texas is people who are just, who are either expectant mothers or people who are just really, really have no money at all. Otherwise, you can't get Medicaid in Texas. So a kind of a Texas loophole that allows people to be able to kind of get coverage in special situations if they need it, is they can just go and apply for Medicaid. And when that letter comes that says, no, you don't qualify, then that person now has a special enrollment period.
Okay. The last question that I had for qualifying people that are, I don't know if this is something that's going to be new for more qualifying changes for people that are becoming U.S. citizens. Is that something that's forthcoming?
Okay, so if you have a green card, you can get coverage. Okay, if you have a work permit, you can get coverage. But if you, one of the things that happened is Trump scared a lot of people away last year. Yes, over the last couple of years, because they came up with this thing where they said, you know, if you aren't a citizen, and we can basically take back any benefits, any federal benefits that you have gotten, and you don't qualify for any new federal benefits. Well, that's not the way it is viewed in Washington these days. So people are encouraged to apply for coverage.
Okay, Mr. Mayfield, thank you so much. If you could please put your contact information in the chat and hang on, stay on the call, we would greatly appreciate it.
Okay.
We're going to transition over to Mr. Corey Cotton. Mr. Cotton is an employee of Texas Hospital Association and a part of NAACP. And he has a guest that he will also be introducing to us. Mr. Cotton, are you on?
I am. Can you guys hear me?
Thank you so much.
Good evening. Thank you so much, Lisa, for allowing us to be here. She said, my name is Corey Cotton. I'm a part of Texas Hospital Association. I brought along Cesar Lopez with me. He's our general counsel. And so I knew we were talking about the ACA and Affordable Healthcare Act. Cesar has worked extensively with Medicaid expansion as well as the ACA. And so I'm going to allow him to do an overview, hospital overview, and talk about other programs in place. And then I'll wrap up and conclude whenever he gets done with this piece of it.
Okay, thank you.
But
Can you put your contact information in the chat as well?
We sure will, but I will say this, Mr. Mayfield, a great job on the explanation of going out and getting enrollment. And so obviously I want to continue to echo, go get enrolled, get enrolled, because right now we have 3.5 to almost 5 million people that are uninsured here in Texas. And we know that is a real problem. And I think by 2040, it's supposed to be up to possibly 6 million, if not more people that will not be uninsured. And so that is a real issue from a hospital standpoint. And what we advocate on behalf every single day is to try to get all Texans to be insured. So not even talking about a federal level, but just talking about here in Texas, how important that is. And so you can imagine what that looks like when people are uninsured. The strain that it puts on hospital systems, as well as Texas as a whole. And so Cesar will speak to that and some of those programs, and I'll kind of wrap it up on the back end. But thank you for having us here this evening.
Thank you for coming.
Yeah, thank you, Corey. Thank you all. And Mr. Mayfield, again, as Corey said, that was a great overview. Really appreciate that information. I think everybody on the call is lucky to have you as a resource on these issues. That's a side of the ACA that we don't really deal with at the Hospital Association. We don't get too deep into the individual coverage type issues. As Corey mentioned, we're much more involved in I guess I would say the attempt to expand Medicaid in Texas, and then really what it turns out being is what can we put in place to sort of make up for the non-expansion of Medicaid in Texas. So for those of you on the call that are unaware, I'm sure a lot of you are, Texas has not, did not, probably will not in the foreseeable future expand Medicaid coverage under the ACA as most other states of the country have. So if you go back to 2010, when the ACA was first put in effect, probably about half the states, maybe 30 states in the country, decided that they would expand their Medicaid program. And so Mr. Mayfield, you talked about that just a couple minutes ago, where it's very difficult in the state of Texas to qualify for Medicaid. In other states that did expand Medicaid under the ACA, if Texas were to expand Medicaid under the ACA, that threshold for qualifying for Medicaid would increase dramatically. It would be tied to your income as the coverage subsidies are, but it would cover probably, we guess, maybe 1.2, 1.5, maybe up to just under 2 million extra Texans would qualify for insurance coverage under an expanded Medicaid program. Personally, I agree with the statement that you all started off with at the top of this hour. I think as an association, we agree with it as well, in that we think everybody should have some kind of insurance coverage, whether it's expanded Medicaid, additional subsidies under the marketplace to go out and get an individual plan, whatever it is. I can tell you guys, since the ACA took effect about 5 years ago, I lived on Washington State, which was one of the first states to expand Medicaid coverage, Medicaid eligibility. I actually had to go onto Medicaid at that time, and it was probably the best healthcare insurance coverage I've ever had in my life. And that's counting coverage that Corey and I get through our jobs at the association. I mean, it was simple, it was straightforward. If I needed to go talk to a doctor or go talk to a specialist or just get a consult or whatever, I would just call up the clinic, walk over, have my appointment, and get it taken care of. And again, it was through Washington State's version of Medicaid, but it was the easiest, simplest insurance coverage I've ever had. And I was probably 34, 33 years old at the time. So it's not like I was a high school, college student, that was going out needing that coverage. So I certainly advocate for that expanded coverage. We, as an association, advocate for that expanded coverage, and hopefully, at some point, Texas will realize how important this coverage would be for individuals, and do something about expanding that Medicaid coverage under the ACA. Now, one thing that I want to kind of point out to you guys that I think is very interesting. The two most recent states that have expanded their Medicaid coverage under the ACA were Missouri and Oklahoma. And both of those states expanded coverage really in the last year or so. But they did so because the voters basically demanded it. There was a referendum in both of those states. The voters put that issue on the ballot, and the voters voted narrowly, really, in both states. I mean, with just over a 50% majority, I think, in both states. But the voters came out and said, we want this expanded coverage. We know that our legislatures are, I'm assuming in Missouri and Oklahoma, very Republican. I'm not very familiar with both those states, but I'm assuming very conservative, very, very Republican, and not likely to do what they need to do as a legislature to expand coverage. So the voters basically, will of the people went out and voted for it and made it happen. So in both those states, Missouri and Oklahoma, they have approved expanded coverage. It has not yet gone into effect, but it will be soon. Mr. Mayfield, you talked about President Biden's act that he signed into effect back in March. That, as you noted, does a lot of things, a lot of things, not just related to healthcare, but the healthcare stuff in there is phenomenal. You talked about mental health. You talked about, these parity issues, making sure that physicians and providers are paid to provide, these mental health and other services that maybe weren't getting as much attention in the past. But there's also additional incentives for states to undertake that Medicaid expansion, that coverage expansion under the ACA as well. The way it generally works now is that if the state does expand coverage, the government will fund 90% of that cost. The state will fund 10% of the cost. Now, in the states that have not expanded, or the states that have avoided expanding, the argument most of those states make, and I'm being very general here, is that, well, if we expand coverage, let's say Texas, and we enroll another 1.5 million people under Medicaid, yeah, we only have to pay 10% of that, but that's still 1.5 million people, even at 10% more than we had to pay for currently. Now, again, that's oversimplification of the argument, but the concern there is we're still paying, the state is still paying more money for that expanded coverage than they would be without it. And really, the argument there is not, again, just playing devil's advocate here, is that if the ACA ever goes away, which a couple of years ago there was a real fear that it was going to go away, what does the state do at that point? That 90% of the cost that the federal government is picking up would go away, and the state would be responsible for 100% of those costs. And so, again, whether that's a good argument, whether that's a bad argument, those are the arguments that are being made against coverage, expanded coverage. And one of the main reasons why a lot of these states, Texas included, again, there's only 12 states left, but Texas is one of them that hasn't expanded that coverage. I made a number of notes, Mr. Mayfield, while you were talking. And again, I'm just kind of hitting the same high points that you did. But one, from a hospital perspective, we want everybody out there to go seek help, to go seek medical treatment whenever you need it, whether or not you have insurance, whether or not you're under Medicaid, Medicare, you have an ACA marketplace plan, whatever your status may be. If you're uninsured and you're having an emergency, you think you need to go to the hospital, you think you need to go to the ER, we urge everybody to go out and seek the care that they need. We don't want coverage or lack of coverage or any questions about your insurance status to be an issue. We will, if you show up to the hospital and you're having an emergency situation, we will take care of you. Your hospital, your local hospital will see you, will treat you. They will do whatever they need to do to take care of you, and we'll worry about coverage and payment and whatever it may be after the fact. And to kind of dive a little deeper into that, I mentioned a minute ago that because we as Texas have not expanded our coverage, we have these sort of tricks and programs that Corey alluded to provide some help to those hospitals that see patients that, again, maybe are uninsured or maybe don't have coverage for that care. And I can go into all of those and do a deep dive in all of those. And I realize it's late in the evening, but I really don't want to put you all to sleep. So I'll just tell you that there's 4 or 5 really sort of well-known tools. The state likes to call them waivers. The state likes to call them, these programs that the state has enacted, most of them in conjunction with the federal government, but they're basically Band-Aids, if you will, to help provide additional coverage to those folks that would have received coverage under expanded Medicaid. But again, we didn't do that. So how do we get help to those folks without expanding Medicaid, without buying into the ACA the way other states have? Well, we have these waivers and we have these programs that will help pay these hospitals for that care that's provided when a patient comes in and they're uninsured or they don't qualify for Medicaid and they don't have a marketplace plan or whatever it is. So again, the point with all of that being, if you're having an emergency, if you need to get to the hospital, go to the hospital, go seek that care. The hospital will work it out on the back end. There's some way to make that hospital whole for providing that care, even if the hospital has to write off that care as sort of charity donated care, unpaid, uncompensated care. And they do get a tax rate on the federal level for providing that care if there's no other benefit available. Again, an oversimplification. Corey and I think can get you guys more information on that if you'd like it. We certainly have a number of explainer documents and one-pagers and white papers and things like that that we have worked up over the last years that we can send to you guys. One more thing that I want to highlight. And again, I know we're coming up on the 8 o'clock hour here, but there, even taking everything I've already said about the state, sort of the state's refusal, the state's inability to expand coverage, the state is doing some good work on the state level to help out in the healthcare arena. We just wrapped our legislative session here in Texas last Monday on Memorial Day. That's our biannual. Every other year, the state meets for 140 days and passes all kinds of bills and regulations and rules and things that the state has to follow. And as you can imagine, hospitals and healthcare are certainly a big part of all of that. But the state is making progress in expanding the ability for folks to seek care, expanding the options for patients to go out and interact with their providers. a big one, and one that really sort of came to the forefront and a lot of folks really started to use because of the COVID pandemic is telemedicine. If you and I had had this conversation, if I'd come to you guys a year and a half ago, even maybe even a year ago, to talk about telemedicine, it was, I would have told you at the time, it's a very promising technique. It's a very promising platform, a very promising way for folks to interact with their physicians and their providers. But it wasn't really widespread as far as its usage. And there were a lot of hoops that patients and providers and hospitals had to go through to be able to effectively use telemedicine, which is basically what we're doing now, just jumping on Zoom, having a two-way conversation. And yes, Teledoc is a great invention, a great service that we have here in Texas. And Teledoc really, again, without going too deep into the specifics, is sort of the reason why telemedicine in Texas has taken off the way that it did. Teledoc actually Teledoc sued the state about 4 or 5 years ago to kind of force the state to allow telemedicine in the state initially. And again, they did that without knowing the pandemic was coming, without knowing how the pandemic was going to affect the use of telemedicine. But really, in the last year, telemedicine has just taken off. Folks at the start of the pandemic, weren't leaving their houses, still had to get to their appointments, still had to have their checkups, had to figure out a way to interact with their doctors, even from afar. And so again, there were a lot of rules that were relaxed on the state and federal level because of the pandemic that really helped telemedicine take off, really eliminated a lot of those hurdles to the use of telemedicine. And what the state did in the last couple of months was keep those barriers from coming back. They basically passed rules and regulations that said, we like what happened with telemedicine. We want to make sure that folks are able to continue using telemedicine because we saw that it benefited everybody. It allowed the doctors and the providers to see more patients during the day. It allowed the patients to be able to interact with their doctors from home without even having to get in the car, drive to the clinic, drive to the hospital, whatever it may be. The state said, we like that. We want to keep that in place. So they kept those barriers to telemedicine low during the session. But not only that, they passed another bill, which I think is pretty significant, that is going to expand the use of broadband services and broadband capabilities throughout the state. So think about these, rural, tiny, communities out in West Texas, South Texas, kind of middle of nowhere, way off the interstate. They don't have Time Warner or Comcast or, whatever high-speed internet services that we might have in Austin or Dallas or, the big metro areas. And without those high-speed internet services, it's really difficult to have a quality telemedicine experience or really set up an ongoing telemedicine practice. So the state said, if we're going to keep pushing folks to use telemedicine and increase use of telemedicine, we need to make sure that those folks have the internet broadband access that they need to do that. So again, just two bills I think that were really important that passed in the legislative session of the last couple of months. And then the last thing that I want to close with is going back and just touching on that ACA Medicaid expansion. Corey mentioned there's about 4 to 5 million uninsured Texans over the age of 18, over the age of 16 that would qualify for expanded coverage. Even if we got the state to expand Medicaid under the ACA, that would probably cover maybe 1.5 million of those 5 million uninsured individuals, which is great. I think it's important. I think that's necessary. I think that's something that we should absolutely do as a state. But we still have to worry about that other 3.5 to 4 million folks that, for some reason or another, wouldn't qualify under the expanded Medicaid, still lack insurance, and still need some sort of coverage. And so again, that's where Corey and myself and all the folks at the Hospital Association, the Medical Association, the folks that work on these issues on the statewide level, to figure out, again, how do we fill in those gaps and how do we bandage and apply that Band-Aid to those areas that aren't covered either by the marketplace type coverage that Mr. Mayfield spoke about or the expanded ACA Medicaid coverage that Corey and I are talking about. So again, that's our job. That's what we go out and advocate day in and day out for. We want to make sure that everybody has coverage. Everybody knows that even if you think you have coverage issues, you can show up to the hospital and seek the care and receive the care, more importantly, that you need. And really don't let these things, I know there's a lot that we're talking about here tonight, but don't let these things get in the way of you taking care of yourself and you seeking that coverage that you think you might need. So again, Corey, I hope that was helpful. I hope everybody on the call, I hope that was helpful for you all. I'm certainly will put my contact info in the chat as well. And if you guys have any questions, please feel free to reach out to me, and I'm happy to answer anything I can.
Absolutely.
Can I say this, Lisa?
Yes.
If you don't mind. A couple of things, and I think Caesar and Mr. Mayfield kind of hit on that, but when you start talking about this Affordable Care Act, and sometimes, you know, it's got the name that's been attached to it, ObamaCare, and sometimes that throws people off, and people think it's something bad, unfortunately, because of the name that's been associated with it. But when you start talking about the Affordable Care Act, you need it to be two things: affordable and accessible to anyone and everyone. And I think that's the gist of the conversation that we've been having here tonight: is how do we make this accessible to everyone? And equally as important, how do we make this affordable to everyone? And so I see in the chat, when you start thinking about how many uninsured in Texas, that's staggering, right? That's a scary number, but that's a real number, and it continues to grow more and more. Two things that Caesar said at the beginning, and I know we all heard it, and I just want to reiterate it. The last two states that passed the Affordable Care Act was Missouri and Oklahoma, and they did that. And this isn't a blue or red conversation. This is talking about affordable care for everyone. They did that because they voted, and they got out, and they made a difference. We represent over 450 plus member hospitals for the entire state of Texas, and they've all backed and got behind this here to try to support this issue. But that's 450 hospitals. That's not the 28 million people here that live in just Texas alone, and we continue to grow by the month. Missouri and Oklahoma voted that. Those are, like you said, typically red voting states. They did that because the people voted. And that's how they were able to get that. That's what the Medicaid expansion is all about that Mr. Mayfield was talking about earlier. That's how we cover that gap of those additional couple millions. Do we still have to put some additional stop gaps in there, like the 1115 waiver, the expansion that Steve was talking about? Absolutely. But one more person covered is better. No matter how you count it, one more person covered is better. There's no other way to look at it. And so we're all trying to be better. We're all trying to be healthier. And regardless of whether you have insurance or not, as in the hospital association, we say go to the hospital. Regardless, that is the main fear for everyone, is that they think they can't afford it, and so you suffer with it. Mm-hmm. Right? It's too expensive, so you continue to work through it until something catastrophic or tragic happens. And that's where a real strain comes in on a hospital, when people continue to wait. Whether you have insurance or not, you should go and take care of yourself because it's worth it. So I think we're all on the same page when we start talking about the Affordable Care Act, of how it's important because it's important. Is it a right or is it a privilege? It should be both here in the United States, of this free land that we call the United States. It should be both. Right? Everyone should have access to it. So again, Mr. Mayfield, thank you for explaining that on how easy and how accessible it is, and being a resource. So we got to get out and spread the word and yell this here. This should be a conversation in everyone's household. If you don't have insurance, go get it. Go to the market. It's there for you, and there's options, and they're easy, and they're affordable, and they're worth it.
That's great. All of that information is really important. What efforts are being made, Mr. Lopez and Mr. Cotton, to try to address the large amount of people that are not covered? What efforts are you all doing to try to reach that crowd?
So a couple of things on the individual level. A lot of our hospitals, probably even most of our hospitals, will work with folks as they come into the hospital. And again, once they're taken care of, it's not, we don't do this on the front end. It's, if you have an emergency, we take care of you. And then they'll come by and talk and say, hey, maybe you didn't realize, but you might qualify for Medicaid. Let's try to get you enrolled. We'll take a shot at that. Like Mr. Mayfield said, if you get a letter that says, you don't qualify, well, now you've got a chance to go on the marketplace and try to seek out a plan. But again, the hospital will do everything in their power. And again, I'm speaking very, very general here, but they will most likely do everything they possibly can to help you figure something out that works for you on an individual level. Now, on the state level, I just put in a link to the chat that's just talking about our efforts on coverage expansion. But if you go to our webpage and you look at, there's a link for a page for state advocacy and a page for federal advocacy. There's all kinds of explainers and one-pagers and stuff on kind of any healthcare related issue you can think of in there. But I actually had a conversation with somebody about this last week where I said, we're out there, we're trying, we're pushing for this ACA Medicaid expansion. We've been trying for years and years and years and years. We do this publicly and we do this sort of in private, behind the scenes, if you will, at the Capitol. Every time the legislature goes into session, we're out there, we're pushing for it, we're pushing for it, we're pushing for it. Now, we might have, as an association, different conversations with folks on the state level, legislators, elected officials in private, as opposed to what might be said in public. And again, that's just sort of a political reality. Those sort of things happen. But I haven't been at THA that long, but I think I'm comfortable saying that I think there are more folks that are interested in ACA expanded coverage in private than maybe they would be in public, if that makes sense. Now, there's maybe not enough of a threshold there to get it done, but I think there are folks out there that understand that this is important, to understand that this is something we should do. And if the situation arises, again, like Corey mentioned, an Oklahoma, Missouri type situation where the voters decide we really, really, really want this, I think some of those folks that would come out in support of this might surprise people because it is a big deal.
Yeah, that is so impressive because as a healthcare provider myself, I've had people actually tell me they don't go to the hospital because they don't have insurance. And I say, well, and they'll ask, do I just have to go to Peter Smith or Parkland? I said, no, you can go to any hospital. Well, I can't afford the bill. And so they don't go. And then with COVID, literally people did not want to go to the hospital that really needed to be in the hospital. And unfortunately, a couple of them did pass away because they were fearful that they would get turned around or fearful of the hospital bill. So
that's the part that truthfully, you hear that and it breaks your heart.
It does.
Because that is the piece where you should just go in, and it doesn't necessarily have to be in it. Don't get me wrong, those two hospitals that you just named, JPS and Parkland, they're great. But any hospital, any facility, you should just walk in and be tended to and care. You're right, and the pandemic really did put a spotlight on the uninsured. During the pandemic, there was estimated another 1 million people could possibly lose their insurance because of that. Of course, that put a spotlight on a lot of things, behavioral health, the immortality rates for women. All those things came to a spotlight during the pandemic. And so there's one thing that we learned, that it takes all of us. It takes all of us. Again, I'm going to keep stressing this here as long as we're on this call. The people in Missouri and then the people in Oklahoma, they made a difference because they got out and they said so. They made their legislators make the choice. And here's another reality, and I'll say this here, and I know we got to wrap up. It's 8:03. When you look in the Senate, this last legislation that we just finished up on Memorial Day, you have 180 plus legislators, seats that are there. You have maybe 5 that are physicians, right? And from what I've heard, this is here, so maybe 2 or 3 of those are veterinarians, right? So where does that put you in the scheme of things of all the positions? Well, these are the people that make the law and put things in the legislation. I'm not saying they're not smart people, they are, but it's not what they do when it comes to healthcare. And so that's where you have, truthfully, the Caesars of the world, trying to explain and trying to educate them. The other 175, because they're still making the decisions, although they have very limited understanding
Right.
of healthcare. Like someone like a Mr. Mayfield, they can explain what these benefits truly do. They're listening to a few talking points and going in and making a decision. And truthfully, that's playing with everyone's lives on here. That's why that getting out and making yourself known when it comes time to vote on those things are that important.
Absolutely. As I always say, one of the goals is for the health committee is to shed light on health crises, problems, and right now disparities, especially in the wake of COVID. So if you're on this call and you don't need this information, please share this information with someone, because I know that everyone on here knows someone that can benefit from all of this information. And there are contacts in the chat where you can give that information to those individuals and share that information. It was one more question in the chat, and I think this was to Mr. Mayfield. If you have insurance with your employer and want to drop that insurance with your employer and go with ACA, is that legal? Is that possible?
If your employer offers group health insurance, then you have to accept the group health insurance with the following exception. If the cost of the coverage for you, not you and your family, but you personally, if the amount that you're paying exceeds 8.5% of your income, then that insurance is considered to be unaffordable, and that creates a special enrollment for you.
Okay. Okay, thank you. Are there any more questions? This was an amazing presentation, and I want to just personally thank Mr. Lopez, Mr. Mayfield, and Mr. Cotton. Thank you for your expertise. Thank you for getting on. I know y'all have been at work all day, and I understand, and it's late. Mr. Cotton emailed me at 7:30 this morning. I'll call you back. I got another call right now. So I appreciate all of y'all getting on the call and for your expertise.
Can I make one comment?
I have one question, Lisa. It's in the chat.
Okay, another question.
I have a question in the chat too.
Okay, is it true that the state of Texas will approve you for Medicaid if you can provide proof of purchase of your own headstone from a certified cemetery? Did I read that correct?
Yeah, that's it.
I hadn't heard anything about that, so I don't know that I can answer that one. I'll ask. I'll find out. But I mean, I hadn't heard that one.
You're almost there.
Probably been proposed.
That'd be a certified cemetery.
Yeah, I know. Okay, we have another question. Is ACA an option for those who are considering retirement and their own company does not offer retiree medical coverage and they are not at Medicare age?
ACA is the right solution for anybody who is under the age of 65 and who does not have group coverage from their employer. If you don't have group coverage, then you should be going to ACA, because you'll have the opportunity to have your coverage subsidized. I wanted to make one more comment though about the discussion that we had with Mr. Lopez and Mr. Cotton, and that is in those states that just added Medicaid expansion, an additional benefit that they get is all of the people who are going to be hired by these hospitals because of all the hospitals, doctors, offices, just the expansion in the economy that will happen as a result of the fact that so many more people have health insurance and they're taking advantage of it. And if you look at that in terms of the number of unemployed in Texas, Texas could significantly improve its economy overnight with one simple decision to expand Medicaid. I mean, hundreds of thousands of people would have to be employed to support all those folks.
I'll echo what Mr. Mayfield just said, and I'll be done. But not only does it drive the economy, equal as important, people are more healthy.
Mhm.
That's the end result of getting affordable care. People are more healthy. Everyone's more healthy. We're a more healthy country. We're a more healthy state. It's a more healthy county. It's a more healthy city. It's a more healthy community. It's a more healthy household. It's a more healthy person.
Yeah, the health disparities are still just unfair and out there. And the changes that we make in more education to the community helps to try to bring those deficits down some.
Mhm.
So on behalf of the Arlington NAACP and Health Committee, my name is Lisa Staples Wary. My co-chair is Dr. Barbara Odom Wesley, and our president, Madam Elisa Simmons. We thank you so much for everyone that's on here. There's some information in the chat, contact information for all of our speakers. And I implore you to share this information with someone, because like I said, everyone on here knows someone that is in need of healthcare or ACA help. And we just ask you to share this information. Thank you, gentlemen, so much for being with us this evening. I appreciate you all, and God bless. Madam President, I pass it to you.
Okay, thank you so much, Madam Chair. What, again, an informative meeting. I want to thank the gentleman as well. Cesar, I understand what you've been doing in Austin, and so I really appreciate that hard work. I don't care about making a political statement, but I should not in this role, but I am who I am. And it won't be that political. But, people proclaim to be Christians and, right to life and all of that. And sit in those seats of power and fight against humanity. I mean, I'm just not understanding ever why Republican lawmakers will not expand Medicaid. I mean, I always say follow the money. So it's some way, somehow it's got to be profitable to them individually or their political careers or whatever. But where's the humanity? And like Mr. Cotton said, it's about healthcare. We want everybody to be healthy. Why wouldn't you want everybody to be healthy? So I am on ObamaCare, and I have been since I started my business 6 years ago, almost 7 years ago. And the number of people I have recommended ObamaCare to, Mr. Mayfield can tell you, I've sent him lots of people. And when I tell them, they just don't even have a clue. They don't have a clue that this is an option for them. The employees, the low paid employees that I employ, they didn't have a clue that this was an option for them. Friends who are about to retire from big engineering positions and executive level positions, they didn't have a clue. And so it's there to benefit from top to mid-range to bottom. And so it is incumbent upon all of us to just tell the people, like I always say, in our circles. I don't know how many people I have sent to Mr. Mayfield, and they're appreciative. They've gone without insurance. They might have been in between jobs, or they might be retiring. It's just incredible. So it's worked for me, and I know it can work for other people. So thank you, gentlemen. Thank you, Madam Chair, for tonight's presentation. And if there is nothing else, it is 8:15 and we will adjourn. Thank you.
Thank you, guys.
Thank you so much, guys.